I'm Michelle Leonard with your Health Sciences and Veterinary Technology Community Report. Today we will look at the extensive work done to engage students and our SBC family with local workforce organizations and the community at large. In March, our Networking Expo and Job Fair brought hiring managers and recruiters from over 20 workforce partners like Baycare, Bay Pines VA, and Sunstar. It was amazing to see the connections that our students made on their path towards a successful career. Since the Health Education Center is located in Pinellas Park, our relationship with the Pinellas Park Gateway Chamber of Commerce is vital. In May, we collaborated with the Chamber to host a truck pull event and an HEC open house that yielded 47 new applications to the college. We have enjoyed nurturing this relationship, and our dedication was evident as we received the Chamber's Large Business Award of the Year. In July, we offered a summer academy to introduce high school students to the healthcare industry. Students learned about the education requirements needed for the field and the SBC programs that we offer. As you can see, our community outreach efforts have made a significant impact in our community. Now we will go to Josh Brown for our student engagement segment.
Thank you, Michelle. Students are engaged in activities such as campus tours, program open houses, Smart Start activities, and other events that are all geared towards welcoming and making the students feel comfortable with our community. In week 5, we cater our community event to Smart Start students specifically. We will be hosting a program open house on our campus, which will allow students who have questions to meet with a faculty representative of a department. Attendees to this event will also have the opportunity to take a campus tour and/or see a simulation exercise in action. In week 10, the Student Success Showcase will be held. This event allows current students to show their work, as well as give the new students the opportunity to see other projects that have been completed. The opportunity to register for classes will also be available at the Student Success Showcase with advisors present. Here is our community in action.
There was a multiple vehicle accident involving 3 adults and a dog on Park Boulevard and 66th Street North. 911 was called and fire and emergency medical services were dispatched. Our emergency medical technicians and paramedics arrive and begin to assess and treat the patients on scene. While one EMS crew is performing CPR on an unresponsive, pulseless, and apneic patient, another crew is triaging and assessing the other patients for transport to the appropriate hospital. The patients arrive at the hospital, and the EMS crews provide a patient report to the emergency room nurses, who are now providing care. The nurse next enters the assessment data for both patients at the bedside electronic health record. This information will be joined with the patient's other medical and billing data by HIT to complete the entire hospital stay. One of the patients has suffered a suspected broken leg and is taken for an x-ray to confirm a fracture. A second patient is having difficulty breathing due to a collapsed lung, and our respiratory therapist will continue the oxygen therapy begun on scene. Another patient who is not wearing a seatbelt and has several broken teeth from hitting the steering wheel will require follow-up dental care. The patient with a broken leg was later discharged and referred to physical therapy for follow-up care and rehabilitation. Unfortunately, another patient's leg injury was severe enough to require a below-the-knee amputation from injuries sustained in the accident. After surgery and recovery, he is referred for prosthesis and orthotics and prosthetics. The dog that was involved was taken to a nearby veterinary hospital. The patient, who suffered a cardiac arrest on scene, was pronounced dead after resuscitation efforts were unsuccessful. After the medical examiner's office investigation, the patient was transported to the local mortuary where funeral services is consulted to discuss and prepare the final arrangements with the family.